incomplete lip. Don't even think you had a major opening up. You've not had a major clefting, so maybe it should not be like that. Because if there is a complete clefting, then the effect will go all the way in.
I don't have that.
So even the scan's not there. So then it's not like, it's not going to be that good. I can give it symmetrical.
Okay. And so this side of the profile, if you can see, so a lot of people have told me that I look a little scarier from this side. Like even if that's not how I am as a person, but
so listen, this is mainly because of the lip and the nasal columnar angle. And again, when you look at the side, even this comes to play. This side is more better than this side. But even the angle, if you see carefully, like this, see this? Or see this? Everything is slightly different. This is a little different. This is a little different. This scar is visible. That's why they say the difference. Can't get you 100% that. You make it better.
The nose, I'm saying what all would be done. Like you'll become.
So hump will go off, will get more feminine. Your nose is now too pointy, too bulbous, and slightly deviated tip. That will correct.
And the tip won't be too droopy also, right? When I smile,
no.
it shouldn't.
No.
Okay.
We're better than this. I don't think we should do much on the symmetry. It's pretty symmetrical, the LR base.
Okay, LR is fine, but I think it's still like this can be reduced a little
bit.
You can just.
And
the thing that you mentioned about the columnar angle, I think that angle thing should also be corrected a little.
Angle thing I'll correct, but then the only thing which might be a little bit of an issue is the tip pointiness. I will make it pointier than this, but because it's a revision, I won't be able to comment. And also, I might need to put a rib in between and get that projection forwards. I have already mentioned to you.
But it won't get too big also, right? The nose, if you put the rib.
The rib is not to make the nose bigger, Baba. It's, in your case, it's because the earlier cartilage has all been taken use of by the earlier surgeon. Sometimes I'm not able to use it again. So that to bolster it. Because it's revision. If it's primary in your case, I would not have needed it. But because it's revision, again I may not need it. There's a good chance I don't need it, but just in case it's needed.
Before my previous surgery, right, I had a droopy nose and that was taken out, but I was left with this bump.
That will go away.
That will never come, right? Because that came back after 1 month and I was just thinking,
how can it come back after a month?
So there was swelling and all, so nothing was visible, it looked straight.
That's the reason why we take videos, so you can see that on the table also. Really, many patients think that 6 month, 4 month, 3 month results are the best. I agree with them. But what many patients also think is on-table result is not genuine, but that's wrong. What is there on table usually tends to come a little later. One thing. And secondly, also get an idea what was there on the table actually, right? Because once the swelling catches up, nobody can imagine what was there on the table. So then the swelling comes like a mask to cover the actual work done.
And how much time will it take for the swelling to go? At least for me to return to work.
If you're working from home, you can work from day 3. If you're going to some office location, give it some couple of weeks at least. At least. Minimum. 4 hafta bhi better.
Good office. I'm on leave till 30th of this month. So first December I can request them for work from home.
That's perfect.
Yeah.
You can work from home in 3 days, I said. So then they'll be happy. You say, I'm fine, I can work from home if you want me to work.
These are my mandatory leaves, I don't want to waste it anyway. So I'll take it either way.
Yeah, sounds good. That is
also, when I smile, it's like, notice one thing, my gum, like this thing is visible only on this side of the.
That big cut you after doing it. There's no problem with your teeth. Smile. Nothing, your teeth are nice. Thumbs are nice. Because the movement of the lip is different, and that's why there's more tooth show on the left side. Once we revise, that's going to go away. Should go away. See, yours is very fine, subtle work, right? And very fine, subtle revision work. Now, 90% I'll be able to give you for sure improvement as in, but 90 to 100% depends on a lot of factors, like what was done before, all the muscles in the place, do I get to mold the lower lateral cartilage, many technical issues. So that's why it's like that. But definitely there'll be good improvement because see, this is something that's like absolutely not on. The tip is like not as thin, it can be narrow, this is thick. So all of those major issues put down will finish.
And overall also like I am very much like my mom. She also has thinner lips. I can see my lower lip is also thin. So will I get any volume in the upper lip like which will match my lower lip?
So right now we are not planning to improve or increase or decrease your lip thickness. I can increase if you want. You can decrease also if you want. We are not doing that right now. Right now our goal is to just move the muscles and put it in the right place so that to give you a lip what it should have been in the first place, but it is not. So that's the goal. After that, after 6 months, once we achieve it now, once it heals for a few months, then if you want to make it a little bit more thinner, we can do it. But not
require surgery?
Yes, I do by surgery because that's permanent. If you want to give fillers, you give fillers. That we can get another surgeon. But I prefer, and this is the way that.
But no fat grafting?
No fat grafting will be done, no. Not now, not later, for clear. No, not needed.
Okay.
We can manage with the muscles by moving it in the right position. I'll get it. Even now I can see these muscles are all extra and this is short. So it's like I just switch them around and that will be able to do it.
Also there's some fat which is like this, like inserted here, you see, that's still there, that makes it look like a V shape was created and fat is just put there.
But part of the fat has disappeared and that's why the notching is again come back. That's why it is symmetry. That's something that happens with fat. Fat doesn't always go away, but it goes more when you have a problem like yours. So I would not